Perfect. Good evening. My name is Alex Schadenberg. I'm the Executive Director of the Euthanasia Prevention Coalition. I'm got Emily with me today in the office, she's basically in control of things. We also have the chat room available, so if you have any questions, you can send them through. I'm going to go through some information, and hopefully there'll be lots of questions, and we can have a fairly good dialogue. And so you should be able to see that there's a chat room at the bottom. Now the question is I'm assuming my sound's going through fine, because I did pre-test it, so that's good, excellent. So I have a PowerPoint presentation here for you, and we're going to talk a little bit about what's going on. The fact is that we just saw the legislation be reintroduced on Monday, the Bill C7, and I'm going to talk a little bit what's going on. I want to first also say that we're in a very interesting predicament, as you obviously are aware, that euthanasia legislation passed in 2016. After 4 years, it's becoming very much something that's being embedded within the culture very quickly, which is a serious problem for us. But on top of that, we have a government that is very much in favor of this and is promoting this. Now, I should actually say a little bit more first, because there are still people coming in. I noticed that the waiting room has a few more people coming in, so it's probably best that before I start the PowerPoint, I'll say a few more things. So we have another predicament, which is the fact that you have a minority government. And in a minority government in Canada, you have a situation where the government has to, in order to pass legislation, it has to make deals with the other parties. And the Bloc Québécois in Canada are very, 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 very pro-euthanasia. And I don't know if I added enough varies, but nonetheless, this is the reality. And at the same time, we have the NDP, who are actually quite supportive of euthanasia too. So we have a situation that you have this whole political dynamic going on right now, which is not actually good for us. Not to say that a Liberal majority would have been better, but just to say that the Liberals, in fact, don't have a problem with getting this legislation through by making deals back and forth. They did not change the legislation whatsoever from the bill that was before proroguing till now, and I am assuming that changes will be made to this legislation during the debate in order to gain support of those other parties, as I was suggesting before. I will also say that, well, we'll go through with this information first now. So today I received a call, and many of you, if you don't know what kind of work we do around here, we're getting calls all the time from people across Canada, from outside of Canada, who have issues with healthcare, who have issues with euthanasia and assisted suicide. And I received a call today from a woman who was grieving because she found out that her aunt is still alive, but was approved for euthanasia. And it was shocking to her. She was actually somewhat close to her years ago. This woman doesn't live near her. She lives, the woman who called me lives in Ontario. Her aunt does not live in Ontario. And this was, as I say, a very upsetting situation. Her aunt had a stroke several years ago. And what happened is that she recovered from the stroke. They actually thought she was explaining that they actually thought she wasn't going to recover from the stroke, but she did. And now she's decided that she wants to die. We received a call from last July. It was not a similar call, but same sort of idea from Catherine Sorenson. She told us that her husband, Jack, had been approved for euthanasia, even though he had received several assessments indicating that he did not qualify. So as you see, there's still calls. There's people coming in from the waiting room. So it's good I'm not going through this quickly. Now, those who have been watching the case of the Sorenson case, you'd understand that what happened here was Jack had several positive assessments saying, yes, you qualify for euthanasia, and he had several negative assessments saying, no, you don't qualify for euthanasia. One of the negative assessments said that his early dementia that he was experiencing made him incapable of consenting effectively. So therefore they said he was incompetent to consent. Another one of the assessments simply said, Jack is not terminally ill at all, right? He had COPD, but he was not late stages COPD, and the doctor made the comment, in fact, he could live longer than, who knows who. The fact is that he wasn't dying at all. But then he had other assessments saying yes. So she said that her husband wasn't dying. He had questionable competency, but she also talked about something else, that Jack was delusional about his health. He had ideas about his health which simply were not true. Now, he's not the only one in this world who has delusional health ideas. Nonetheless, this was him, okay? She also kept on saying to me, you have to understand, if you meet Jack, you'll realize he's an excellent actor, so it's easy for him to be believed. What does it mean to be human? Well, and McCarthy's just joining us. Physical or psychological illness and suffering are universal human experiences. We all go through physical suffering. We all go through a type of psychological issue, not illness necessarily, but certainly sufferings where we are emotionally affected by things happening in our life. Often the physical and the psychological are interconnected. So when you start thinking about this issue of euthanasia, you understand that, people, we all go through a level of suffering. Some, of course, greater than others. Nobody wants to suffer. In fact, people fear suffering, and many view suffering that is worse than death. Now, I should say that if anybody wants my PowerPoint, you just have to email me at info@epcc.ca, info@epcc.ca, and I'm happy to send it to you. And I'm just going to put that on the chat for those who have their chat up. And I'm happy to send it to you, so you don't have to take notes or anything. So suffering has then become an acceptable reason to kill by euthanasia, and in some cases, it's the primary reason. We need to be concerned about people who then lose hope, who lose purpose, who fall into despair, because this is a normal human reaction to physical and psychological human suffering. We live in a culture of loneliness. So one of the things that's really changed, like people always ask the question, how come in 2020, when there's so many things we can do to help people, how come we are now killing people by euthanasia, whereas we didn't do this in the year 2000 or 1990 or 1980 when there were less things we could do to keep people comfortable? And I argue clearly that this is a culture of loneliness and isolation. There's a lot of social abandonment in the culture. This factor drives people to consider suicide and or to seek assisted death. And these are becoming normalized within the culture, this culture of loneliness that we have. And in fact, COVID has made it worse. COVID has made it worse because we've been denied the ability to be with others, and people who have vulnerabilities, people in nursing homes, etc., are being denied visitors. That's a serious, serious problem, okay? There are more people who live alone, lack significant community, feel hopeless, or feel that there's no purpose to living than ever before. Now, one of those reasons might be this change of a culture that had an interconnectedness with faith, and that certainly has changed within our culture, and so you would see more hopelessness and less purpose. Now that euthanasia is legal, people are seeking death by euthanasia as a way out, and I refer to them as deaths of despair. These are ways out from their normal human reality. Prime example, Jack Sorenson. That was a prime example. The human being is communal. We're made to be with others. Therefore, loneliness and depression, which are universal human experiences, that even though they are varied by each individual, we each experience these things differently, we're each emotionally different, and we react to things differently, that these are normal human realities for all of us. We all feel loneliness. We all become depressed. And when we're alone and lonely and depressed, we all at times sometimes feel that our life has lacks purpose, lacks value, lacks a reason to live. And this is one of the explanations that I can give you for why the data shows we've had such a massive acceptance of euthanasia in our culture. So these are the Ontario stats. Now, not everybody on this presentation are from Ontario. Nonetheless, you can see the data in Ontario, how it's taken off. Now, we saw that there were 1,789 assisted deaths last year, 1,499 the year before in Ontario alone. There's already been 1,517 up to August 31st of this year, and I haven't seen the September numbers yet. I'm assuming that we will go way past the numbers of last year, probably into the range of past 2,000 deaths, well over 2,000 deaths in Ontario this year. And and I see that as continuing. The data also shows that 516 physicians and 41 nurse practitioners participated in those deaths. And just so you know, there was 2 assisted suicide deaths and 5,833 euthanasia deaths. So when you legalize euthanasia and assisted suicide, it's very clear that euthanasia becomes the primary way of death. Now, what's the difference? Now, pretty much everyone on this call may know it, but if you don't, euthanasia is when I would then lethally inject you. I inject you. I kill you. That's euthanasia. Whereas assisted suicide is when I provide you the means. It's usually done with the same drugs, but you do it to yourself. Euthanasia is easier than assisted suicide because it's easier to get someone to kill you than for you to kill yourself. It's very much easier. And also it's sadly cleaner, and we don't have to get into that. So when euthanasia was debated in Quebec, the Quebec Minister of Health stated in 2014 that it'd only be about 100 per year. Be about 100 per year. That's what we were being told by the Quebec Minister of Health at that time. And I reported that because I thought that was very interesting, that they thought there would only be very few deaths. Health Canada released its first annual report, and you see some of this data. There was 5,631 reported assisted deaths in 2019 in Canada, which accounted for 2% of all deaths. So that's in the 1 year, 5,631 in the 1 year alone. Since legalization, so up until December 31st, 2019, there was 13,946 reported assisted deaths, in Canada since legalization. And I'm predicting that we will go past 20,000 before December 31st. So what are we seeing? We're seeing a normalization of euthanasia, of killing. This is a serious problem in the culture. How do you reverse this normalization? How do you deal with this normalization of killing? The data show that 82.1% of these people, they wanted this because they felt a loss of ability to engage in meaningful life activities. Well, that's very interesting. This is a social reason. This was followed by a loss of ability to perform activities of daily living, 78%. Inadequate control of symptoms and other pain or concern was 56.4%. Now you have to understand that when we're looking at these issues, that in fact they're rating these things, right? The person is rating why they've requested euthanasia. So when we're saying 56.4%, the question would become, what was their primary reason? 13.7% stated that isolation and loneliness was the reason they were asking for euthanasia. Now, I actually believe that number is probably higher. Now, why am I saying that? Well, a lot of people who would be going through what they would call loss of ability to perform activities of daily living, these are like a human reality, but it's their loneliness and isolation, it's their feeling of lack of purpose that is in fact driving that desire to die. So I'm suggesting that in fact the data, because it's not, how would you say, based on primary reasons, it's not digging deeper, would probably actually show the reality is different than the actual data is showing. The Quebec report, and a lot of people haven't looked at the Quebec report, and for instance, Amy Hasbrook, who's the president of the Euthanasia Prevention Coalition, and she lives in Quebec, has done significant research into the Quebec report. Now, Quebec publishes a separate report than the federal government, and the Quebec report showed that there was 13 assisted deaths in the 2018, 2019 year that did not fit the criteria of the law. Now, how do they know this? Okay, so Quebec actually does a deeper investigation into the numbers, and Quebec has what they call a multi-reporting system, whereas the federal government doesn't have a multi-reporting system. So therefore, the federal report, all it did, when you look at this data, all it does is it's looking at the data that it receives from the physician or the nurse practitioner who killed the patient. So Dr. A kills person B. Dr. A is required by the law to send in a report, and they fill out the report and they send it in. So what we have is we have a self-reporting system. So you then have that data is the only data in the federal report. Now the Quebec data is a little bit different. They actually have 3 sources of data that they use to put together their report. Federal government doesn't do that. So the federal government report doesn't even attempt to find data or to even present data which would show possible abuse of the law. Because of course, doctors who kill someone or nurse practitioners who kill someone are not going to self-report abuse of the law. It just doesn't happen. In September 2019, you all know this, the Quebec Superior Court in the Truchon decision struck down that natural death needed to be reasonably foreseeable to qualify for euthanasia. So this requirement of the law was the quote, terminal illness requirement. Now remember, that requirement was never quite really a terminal illness requirement because the federal government never defined natural death as reasonably foreseeable. And it's nothing personal, but I think that all the people listening to me right now, you need to know that your natural death is reasonably foreseeable. It was not defined, okay? Simply not defined. But by knocking out that natural death being reasonably foreseeable, the law said that you were allowed euthanasia for physical or psychological suffering. That's what the law said. Physical or psychological suffering, but your natural death had to be reasonably foreseeable. So by removing natural death as reasonably foreseeable, then in fact you're allowed euthanasia for physical or psychological suffering. Stop, right? No need for terminal illness. Psychological suffering is not defined in the law. Not defined in the law. The government did not appeal the decision, as you know. By removing natural death as reasonably foreseeable requirement, the court decision actually then extends euthanasia to people who are not terminally ill, but also people who have psychological conditions alone. You have to understand that that's exactly what it did. Now, let's go to Bill C-7. As you know, Bill C-7 was introduced after the online consultation, which I called a fake consultation. Now, I did encourage everyone to participate in the fake consultation because I knew it would be the only consultation they were going to give us. So, you know, it's better to participate in something than to be completely absent from it. Nonetheless, Bill C-7 has now been reintroduced on October 5th. Now, remember, they have to get this bill through by December 18th, which I think is probably impossible unless they cut deals, which is my concern. I believe they're going to have to cut a deal with either the Bloc or the NDP, which means there'll be further amendments to Bill C-7. Bill C-7 permits euthanasia for incompetent people who have already been approved for death. So what it did is it said, if you were already approved for euthanasia, but at the time we come to kill you, so by the time the doctor comes in the room to inject you, if you've become incompetent, then you're still good to go. We can still inject you. Now, what did that do? It removes your right to change your mind. Bill C-7 also eliminated the 10-day waiting period when the person is deemed to be terminally ill. So Bill C-7 says if you're deemed that your natural death is reasonably foreseeable, then the 10-day waiting period is eliminated. It reduces the number of witnesses for the euthanasia request, and it creates rules for euthanasia when someone is not terminally ill or dying. There's more to it than that, but now we're going to go into more information. So Bill C-7 removes the requirement that a person's natural death be reasonably foreseeable. It's very important because that's what the court required. Now, this should have been appealed, but it wasn't appealed. I've done many articles that talk about why it should have been appealed. And there's actually more to this court decision than meets the eye. Nonetheless, Bill C-7 decided to go much further than the court decision required. Bill C-7 permits a doctor or nurse practitioner to lethally inject a person who's incapable of consenting if that person was previously approved. Now, I'm arguing that this actually contravenes the Supreme Court of Canada Carter decision. Now, why am I saying this? Because if I'm right, then of course this will be struck by a future court decision, right? Because the Supreme Court of Canada Carter decision stated that only competent people could die by euthanasia. It didn't say only competent people could be approved for euthanasia. It said only competent people could die by euthanasia. Bill C-7 created a two-track law. A person who's deemed to be terminally ill, or natural death being reasonably foreseeable, whatever that means, would have no waiting period, while a person who's not terminally ill would have a 90-day waiting period. So when I mention that someone could die who has psychological suffering alone, if they've approved that person for euthanasia, they would have to have a 90-day waiting period. What if I have a chronic condition? I'm not terminally ill at all, but I have a chronic condition. So I do experience physical pain, but I'm not in any way dying. I'd have to have a 90-day waiting period. I'm arguing also that this will be struck down with a future court decision. Well, why is this? Well, if you start reading the different Supreme Court decisions we've had in the last, since the Charter of Rights and Freedoms, you can't actually have an inequality in the law. The inequality would have to be justified by something. So for instance, The law says that you can only drive when you are 16 years old, you can only drink at a certain age, etc. You can only vote at a certain age, etc., etc. These are justified by societal requirements. But you see, something arbitrary, such as a 90-day waiting period or no waiting period, is not justified because it's arbitrary. It's just chosen. It's just an amount of time that's chosen. It will get struck down by a future court decision. So this, right off the bat, you're looking at these laws and you're saying, why did the government write the bill this way? I believe they write it this way because they intend for it to expand over time. And the way you expand it over time is you write it in such a way to allow certain things to get struck down. Bill C-7 claims to prevent euthanasia for people with mental illness. Now, just so you know, polling has been done, and it shows that Canadians don't want euthanasia for mental illness. They just don't want that. Okay, now that makes some sense. You know, if you're pro-euthanasia, you might say that someone with mental illness should not qualify. So they put right in the bill that you cannot, euthanasia does not qualify for mental illness. But it doesn't actually say that, because the law permits MAID for physical or psychological suffering that's intolerable to the person, so it's subjective, and that cannot be relieved in any way that the person, subjective, considers acceptable. So it's not about the doctor examining me and determining that my pain appears to be uncontrolled or intolerable. It's totally that I say my pain is intolerable, and I'm saying that it cannot be relieved in a way that I consider acceptable. So even if I'm experiencing a medical condition which is treatable, if I say that the treatment is unacceptable, therefore I would still qualify. Psychological suffering in the legislation has not been defined. No definition. So if you do not define psychological suffering, then in fact, mental illness, which is not defined in the law, will be treated as a form of psychological suffering. All right? It's totally clear what's happening here. They put something in the bill to make Canadians think something is true when in fact it's not true. If the government wants to exclude euthanasia for mental illness, then Bill C-7 must define psychological suffering. It has to do so, but it doesn't do so. So leaving it undefined means it will simply be. It'll simply allow it. Certain doctors will say that they accept it. Others will say they don't, and it will just simply happen, okay? Bill C-7 waives the 10-day waiting period when a person is deemed to be terminally ill. Therefore, someone can request euthanasia on a bad day and die the same day. Have anybody on this webinar ever had a bad day? I mean, a really bad day. Well, think about it. Think about it. Studies prove that the will to live fluctuates. So if you read the studies on the will to live, you can Google that. Dr. Harvey Chachanoff did those studies. He's a Canadian psychiatrist. And he proves without a doubt that a person's will to live will fluctuate over time. Meaning one day you might want to die, the next day you want to live, right? Bill C-7 permits anyone who believes that their physical or psychological suffering is intolerable to the quality, as long as I consider it intolerable, then I qualify for death by lethal injection, but I would have to wait a 90-day waiting period, even if effective medical treatment for that condition exists. Seems ridiculous? It is ridiculous. Bill C-7 must be stopped or amended. Now, it's going to be amended, I believe, anyway. I could be wrong, but I think so. I think they're going to have to cut a deal to get it through quickly. How they amend it, I don't know. Anyway, Bill C-7 must not permit MAID euthanasia when a person has become incompetent. I tell people about the Dutch case. If you follow my blog and my issues, you'll have remembered it. It was the case of the woman in the Netherlands who had asked for euthanasia. And then when she had dementia, they then went ahead and told her that they were going to do the euthanasia, and she said no. In fact, she resisted. They put the sedative in her coffee to sedate her, and she continued to resist. And then when the doctor, which was a female doctor, went to inject her, what happened is that she was resisting, so the family had to hold her down as she was injected. Now, according to this decision, that would be fine, right? Because she had been previously approved for euthanasia, but once you become incompetent, then they can go ahead and do it. even if you're resisting, they could go ahead and do it. Bill C-7 must define psychological suffering to actually prevent euthanasia from mental illness. I've already said that. They must also define this phrase, natural death is reasonably foreseeable. It's undefined in the law. What does it mean? Nobody knows what it means. Whether you, I was on the euthanasia the pro euthanasia webinar the other day. They admit they don't know what it means. We're asking you to contact your members of parliament. State your opposition to Bill C-7. If you ask me for my PowerPoint, if you don't ask for the PowerPoint, I can still email you the links for your members of parliament. We also have an online petition that we have online, and we've had almost 35,000 signatures to reject euthanasia Bill C-7. So you can, if you haven't joined that petition yet, you can join that petition. But the biggest thing is to contact your member of parliament. Why? If enough people contact the members of parliament, at least it gets the attention. The member of parliament will at least start asking questions or thinking about it. As it is right now, a lot of them know it's a controversial issue, but it depends on what party you're in. They might just think, well, you know, this is what we're doing. What's changed in Canadian politics? I'm 52 years old, and I've noticed that what's changed in the last 30 years is it used to be an attitude that if you were elected as a member of parliament to a certain party, you had to vote with the party on what they would call bills that would cause, how would you say, a non-confidence vote. So if it were, let's say, a budget or the throne speech or things like that, you had to vote with the party because, of course, it would result in a non-confidence vote if you didn't. But other bills, which would be like this bill, would be seen as a conscience bill, and you can vote the way you want. And there used to be a time where there was more, how would you say, back and forth within the party politics. Today, that seems to be almost non-existent. Okay, that seems to be almost non-existent, meaning it's very hard, but most liberals are just going to vote for this. And if the party, if the Bloc or the NDP cut a deal with the liberals, you'll see that they'll just vote the same way. Chardine says, would like the slides very much. I can write to my MP. Chardine, just email me. I actually have your name now, so and I know you, so I'll just send you the PowerPoint and whatever information you want. Conscience rights. Now, this is very important. I already mentioned the number of doctors in Ontario who've participated in that previous slide, that there's significant numbers have participated in euthanasia. They've killed their patients. But in Ontario, doctors are required still to do a refer, and it's called an effective referral, when a patient request's made. This is a serious, serious problem. So if you're a physician and you believe it's wrong to kill your patients, you must do what they call an effective referral. Now, I know there's a lot of physicians who have been trying to get the government to pass legislation. They've been lobbying. So for instance, you need to know the Ontario Medical Association has changed their position, and they're now in favor of conscience rights. You may not know that. The Ontario Medical Association is now in favor of conscience rights. The palliative care physicians groups are in favor of conscience rights. It's the Ontario College of Physicians. It's the college. So that's the regulating body. They're the ones who are actually forcing the effective referral. So if you're thinking of the politics of the physicians, there's a lot of doctors, even doctors who support MAID, euthanasia, etc., who would say, yeah, but if I don't want to do that, I shouldn't have to do that, okay? If the federal bill protects conscience, or at least says doctors should not be forced, how can the Ontario College? We don't actually have a federal bill that's passed. Federal law, just reacting to Jackie asked about a federal bill protecting conscience rights. Federal law is, remember, this is a provincial issue. Conscience rights deal with the issue of medical treatment decisions. Therefore, it's a provincial issue. Federal law can regulate conscience rights only through the criminal code, but it can also regulate it in the sense that the federal government is responsible for the military. It's responsible for the territories, and the federal government's also responsible for Native issues. So in fact, conscience rights could be protected for the military, doctors, et cetera, territories and Native groups in that by the federal government, unless they put it in the, and there's another question, unless they put it in the criminal code. Now, is the criminal code the best place to deal with conscience rights? It might be the only place to deal with it. It's not the best place. The best place is at the Ontario government level because they're in charge of healthcare, right? Now remember, Doug Ford said in the last election, if you're not from Ontario, that's fine. If you're watching this and you're not from Ontario, Doug Ford said in the last election he did believe in conscience rights and he would protect conscience rights. He just hasn't done it. Just hasn't done it. So pressure to kill. Delta Hospice Society. Well, actually, the Delta Hospice Society was in court yesterday. I'll get to that in a second. Hospice organizations are being forced to participate in euthanasia, and this breaks my heart. I was just at an event recently talking to a palliative care, a woman active in her local hospice palliative care organization, and she's just sort of dumbfounded by the fact that her palliative care group, which was always against euthanasia, is now offering euthanasia, MAID, lethal injection, because the government is saying to these organizations, if you're accepting government money, you're going to be doing it. So you have the case of the Delta Hospice Society. The Delta Hospice Society opposes euthanasia. They were told by the BC Minister of Health, Adrian Dix, that they must offer euthanasia or they will lose their funding. That's like a pretty big stick if you think about it. The Delta Hospice Society has been given until February 2021 to accept euthanasia or cease operations. And the BC government has also implied that they will expropriate their building. Now remember, the Delta Hospice Society is an independent, nonprofit charity. The building that they're in is owned by the Delta Hospice Society. So if the government of BC can come in and just expropriate a building, well then I guess we're all up for expropriation, you know? The Delta Hospice Society was challenged in court by a group of local euthanasia activists. The court decided that the Delta Hospice Society must accept memberships from anyone who applies for membership. Now this is interesting, especially if you're a member of an organization which is a private organization. You might be a member of a private golf club. You might be a member of the Knights of Columbus or the Catholic Women's League. According to the ruling of the Delta Hospice Society ruling, you must accept members from anyone who applies, even though you're an independent, nonprofit charity. The Delta Hospice is selling memberships to prevent the euthanasia lobby from taking them over. So if you want to buy a membership from the Delta Hospice Society, we're certainly encouraging you to do so. The Delta Hospice Society is a private organization. There's also a BC provincial election going on right now, so that might actually lead to a change. Let's hope it does. A few stories, euthanasia about freedom and autonomy. Well, everybody should know the Candace Lewis story. She was born with multiple disabilities. In 2016, Candace was pressured by a doctor to ask for euthanasia. Candace did not die by euthanasia, but Candace never asked to die. She never asked to die. She never made a request. She was being pressured. And the reason was, yes, she was very sick, but it was a doctor who was pro-euthanasia, and he looked at Candace, and she was very sick. She's born with multiple disabilities, and he thought she was better off dead. How many people have died by euthanasia because they were pressured by medical professionals? We don't know. There's not that many Sheila Lewis's, Candace's mother. Sheila is like a loving bear who took care of her daughter because she refused to allow them to pressure her daughter. She stepped in. But on top of it, this is the rest of the story. Many of you know the story. Sheila was being told that Candace is dying. Candace was very sick. There was no question. Candace is dying. So Sheila decided, well, then I'm going to take Candace home. She took her home. She just said, you know, we're going home. If you're going to die, then you should die at home. Well, Candace didn't die. Candace got better. Now, does that happen to everyone? No. But the fact of it is she wasn't dying. She was very sick, though. Last year, I received a call from a woman in Ottawa whose brother-in-law was approved for euthanasia. Her sister was so upset about her husband's planned death by euthanasia, she couldn't speak to me. She was so upset. I spoke for a long time to the woman and her husband about their brother-in-law, and her husband agreed to visit him and speak to him man to man. I told him to tell his brother-in-law that ending his pain this way would actually transfer his pain to his wife. They had been married over 50 years. She was completely opposed to euthanasia, which she agreed was murder, and her husband was approved for it and was wanting to go ahead with it. Sadly, that's just what happened with Catherine Sorenson. They were married 48 years. They called to tell me that the brother-in-law changed his mind after his brother-in-law spoke to him. A palliative care doctor also assured him that if he was suffering, meaning if he was really in extreme pain, he could be sedated. The next week, he died a natural death. He was very close to death already. And I asked the family, since he was already near to death, why did he want to die by euthanasia? He was near to death. And they said that he had told them he was tired of dying. He had lived several months through the process of dying and he just wanted it over. And my response was, these are normal human feelings. There's a question from Jackie here that I think is important. If the hospice could raise the funds to replace what they receive from the government, would that lift the pressure of the for the charity, for the Delta Hospice? Is it feasible? Well, I think it would be feasible, Jackie, but we're talking about about 1.5 million a year they'd have to raise extra. So if those people who really support a hospice that refuses to kill you, and they're willing to donate big money to make that happen, and also to force the government to step aside and say, well, I guess we have to leave them alone, then I guess that would work. But I'm not sure, and they're not sure if Canadians would be that generous with them. But it is possible. The Sorenson case, I began this PowerPoint by mentioning the Sorenson case, and I've been talking about the Sorenson case for a while. I actually got a call then from Catherine in July. Now, Jack just died on Saturday. Last Friday, the Nova Scotia Court of Appeal decided that the court has no role in the review of MAID eligibility assessments. This should concern you, actually, because therefore, so long as 2 doctors or nurse practitioners approve a death, it doesn't matter if other assessments disagree. Remember, there was 2, in the case of Jack Sorenson, there was 2 assessments that said he didn't qualify. So 2 assessments saying he does qualify is all that the law cares about. So we have to think this through. What if an assessment is false, or if the requester is delusional, such as Catherine says Jack was, about their medical condition, but the assessor believes the delusion? This is an important point, because now we're talking about competency, we're talking about these decisions and how they go. It's very important to consider how the law is designed that 2 doctors or nurse practitioners can approve, and it doesn't matter how many else said no. There could be 10. Now, I'm not saying there is a situation where 10 said no and 2 said yes. I'm just saying that that would also qualify. Catherine's lawyer Hugh Scher argued that the federal MAID law requires application in accord with provincial laws, which is true, because the law says that the MAID law must be dealt with in accord with provincial laws. That's why each province passed their own euthanasia law. So this would include consent and capacity. This is what Hugh Scher was arguing. Where capacity is at issue, provincial consent and capacity laws across Canada call on courts or tribunals to resolve these conflicts. Let's think this through, what Mr. Scher was saying. Let's say your relative is asking for a medical treatment, but your relative really is incompetent. Clearly they're incompetent. Who then makes the decisions? Then the person who they appointed to make decisions, their power of attorney, makes decisions for them, okay? But what if there's a dispute? The doctor is suggesting we need to do this, and the patient or the family is saying, no, we don't agree. Well, how it works right now is it goes to, in Ontario, we've got what you call a consent and capacity board, and the tribunal then will hear the dispute between the hospital, the doctor, and the patient, or the patient's family or decision maker. But even in Nova Scotia, the same thing exists, where you would then go to the court and you would ask for the dispute to be resolved. And that's what Hugh Scher was attempting to do. He was showing that you have assessments saying he doesn't qualify, you've got assessments saying he does qualify, you've got a wife saying that her husband is not really competent anymore and that he's delusional, and clearly he's not dying also. So when you start putting this together, you understand where they were trying to go with it. And Hugh Scher argued it would be criminal to subject terminal treatment decisions under MAID to less protection than any other treatment decision. So any other treatment decision, when there is a dispute, there is a way to go to the court and have that dispute settled. Whereas in the case of euthanasia, where your life will be ended, there is no dispute mechanism. A little bit ridiculous. It means it actually doesn't follow provincial law. Hugh's argument is that either we have to amend provincial laws, which I think he's correct about, or B, we have to recognize that in fact the law is not treating the MAID in the same way as other issues. That in fact it's giving it a higher level for some reason. Why do people ask for euthanasia? Well, we're told that people ask for euthanasia because of pain or physical suffering, but the data suggests that very few people actually are asking for it for these reasons. There are people who are radical autonomists, who are demanding death by lethal drugs. It's my right, my choice, right? But there's very few of those. Most people ask for death because they're at a difficult time of their life. They are lonely, depressed, socially isolated. They've lost hope. They've lost purpose. In the case of Jack, he felt his life had no more purpose. He felt he had no more purpose. He was actually also in fear of a bad death. He was in fear of a bad death because he thought he had medical conditions he didn't actually have. Charlene, I'll get to your question in a minute. I'm going to go through more of my stuff, and then I'll get to your question. I contend that the reasons people die by suicide are then similar to the reasons why people die by an assisted death, by euthanasia, even though the circumstances differ, right? Or may differ, not always differ. Most people who ask for an assisted death feel that their life lacks purpose, meaning, or hope. They feel that no one cares about them. They feel like they are a burden to others. These are normal human feelings. And when a person is lonely, depressed, socially isolated, or feeling abandoned, and they feel that their lives have no purpose, their life is then threatened by euthanasia. What am I getting to when I'm saying this? This is about normal human realities. We all go through these feelings. Therefore, everyone is affected by this issue. The other thing is, we shouldn't be overly, how would you say, we should recognize that even people who have strong faith, or even people who seem to have strong control, may go through what you call that deep depression, that dark time of the soul, where they feel that there is no more purpose. They're almost like wearing a set of blinders. They've become so deepened by their emotions and their feelings. And they might ask for something that they would have never otherwise asked for. Why? It's because they're human. It's because they're human. Human experience tells me that it's normal for a person who's experienced serious illness or personal difficulties and loneliness to also fear for their future, question their purpose for living, experiencing existential distress, that's not uncommon, situational depression, or lose hope. Suffering alone, loneliness, isolation, depression, loss of hope, these are all leading reasons why people are asking for euthanasia, suicide, and all of these are what I call normal human feelings. This is why this issue has taken off so quickly, so fast, because it's dealing with us at the crux of who we are as human. The culture of abandonment leads to an assisted death, and it can be changed. We can change this culture by caring for others. Okay, I will deal with that in a second, Jackie. Actually, maybe I should deal with that now. I was going to go back to Charlene's question, though. Alex, can you clarify for me if that physicians are not supposed to bring MAID up to their patients? No, there's nothing in the law that says physicians can't bring a MAID up to their patients. So if the patient should raise the subject first. No, the law doesn't require the patient to raise the subject first. It sort of was bantered around during the debate in 2016 that this should only be something that someone asks for and that it not be brought up by physicians, etc., because that would be seen as a form of coercion or pressure, especially when someone's down. But the fact of it is that no, it's not in the law. Now, there is a group, ARPA, that's asking that the law be amended so that only a person can ask for it, but it not be something that would be, how would you say, being brought up by the physician. I'm not sure if that can go anywhere, to tell you the truth. It might. It's worth talking about. It's worth pressuring the government to try and make a change. But the fact of it is that physicians groups, etc., have been saying that this is a form of healthcare. I don't think it's a form of healthcare at all. I believe there's nothing healthcare, quote, quote, about killing somebody. Nonetheless, if this is going to be treated as a form of healthcare, then the fact of it is doctors and nurses must make, how would you say, provide all the options to their patients. So you can have the option of surgery, chemotherapy, you can have all these options, and they include MAID. MAID is one of the options, and you can't deny your patient one of the options, and that's what they're saying to us, as crazy as that might seem, okay? It is essential for people who feel that their life lacks value or feel that no one cares for them are offered purpose, support, genuine hope from a significant community. And now we have COVID. Think about this. You can't go visit your mother, or maybe you can, but you're discouraged from visiting your mother who might be very elderly and she might need someone to talk to. You can talk to her on the phone, and I would encourage you to do so. But I mean, face to face is what we are as humans. We communicate with each other. We share emotions, right? We share emotions. Culture of Loneliness, survey of 1,896 seniors, 65 and older in the UK. This was done in 2018. This survey, more than 22% of them, 1 in 5, said that they have a conversation with no more than 3 people over the span of an entire week. A quarter of older adults said it makes them feel good when someone smiles or acknowledges them while waiting in line at a bank or grocery store. I'm not saying you shouldn't wear a mask, but it's awfully hard to show your smile when you're wearing a mask. I'm not suggesting you shouldn't wear one though. 1 in 5 would be thrilled if someone stopped to ask them how their day was. This is what we're talking about in the human family, what people are going through. According to a census in the US, 12.5 million people are now over the age of 65, okay? That's 28%, sorry, 28% of Americans are over the age of 65. The national poll showed that 1 in 3 seniors are lonely. So this poll that was done by the American Association of Retired Persons. Almost 30% said they socialize with friends and family and neighbors only once a week or less. Once a week or less. Research shows that chronic loneliness impacts older people's memory, physical well-being, mental health, and life expectancy. I could go into that, but I'm not going to go into that. So we're called to call people, visit people, be with people, care for others. Here's the thing, if I don't know you, I guess I can't do that. But if you know someone, you should do that. I got the call today from the woman talking about her aunt, and I said, can you go visit your aunt? Her aunt lives a long way from her. But I suggested, can you visit her? Why? Obviously speaking, being with someone might give you the opportunity to help them find a purpose to live. Being with someone might reinforce that as a human person, they remain important. Whether it be your neighbor, whether it be someone you know from a church, whether it just be somebody you know of and you've met on several occasions, being with people is fundamentally important to this whole issue of euthanasia and assisted suicide. Now, Gordon put a question, or not know if it's a question, but statement. With regards to mental causes alone, psychiatrists and psychologists are also hostage to many years of claiming that physical and mental illness are equivalent. This is not actually a scientific concept, but they would be very reluctant to admit that. I agree with you, Gordon, and that's probably why the law is the way it is. I think you're absolutely right, that they have sold the idea that physical and psychological ailments are identical, and in that sense, then how can you deny that? So we have the Compassionate Community Care Organization that we work with, and it has a training program, and it also is a place that people call with the 1-800 number, and there's calls coming in regularly from people dealing with issues, dealing with end of life, dealing with euthanasia. Got a call, just so you know, got a call on Friday, and it was a guy in Toronto, and it's very sad. Both his mother and father, who were very elderly, had caught COVID. So both of them were in the hospitals. Okay. His mother had not recovered yet from COVID, so he couldn't visit her, and she was in her late 80s, and his father was 94. Now he had a bit of dementia going on, so that wasn't good. Now he did recover from COVID, but COVID had affected him when he was in the hospital, and he had been on a ventilator for a while, recovering from COVID. I'm actually amazed that they put him on a ventilator. For a lot of people, they were denying people who were 94 ventilators, but that's a whole nother issue. But he had lost his ability to swallow. Now this might be temporary, right? Might be temporary. And then the doctors are saying, well, we don't think we can give him any food or fluids or anything because he's going to then choke on it. And so he's calling me saying, well, what can we do about this? So we had conversations back and forth, and I spoke to his siblings. And the interesting thing is I had my anniversary, and I was went with my wife for a couple of days on our 30th anniversary, and I'm getting calls from them, and I'm taking these calls, we're dealing with it. I got a call again then yesterday, one more time. We talked it over, how he should deal with his doctors and the ethicists and everything. And I got an email today saying that they've agreed to provide him food and fluids. They're going to put in a feeding tube and everything. And of course, their hope is that he recovers. But the other thing is, it's possible that he might be approaching death. We don't know. They don't know. But shouldn't he get the opportunity to recover? These are the kind of calls we get. And a lot of people have no idea how to deal with these issues. And they just don't, because this is outside of what they would deal with in their everyday life. And so this is something that I get to talk to people about. We are affected by the legalization of euthanasia because we are human. We experience similar human emotions and feelings. Cultural loneliness affects our health. It affects our quality of life, and it's a threat to our life. We need to organize. We need to visit. We need to be with. We need to care, but we need to stand up. So if anybody wants the PowerPoint, I'm happy to send it to them. Now, I do have a few more questions here, and I have to pull this Zoom thing, group chat. I have to go out here. Now I can go up. I moved it over because I went over this question Chardine had asked. I didn't answer it. Isn't the whole idea of hospice to die with dignity for people who want that peace, love, and dignity of a person? I guess whenever the government is involved in healthcare, we know that healthcare is rationing and a socialized medicine model. So Chardine, yes, you're right. That's what the purpose of hospice has been. What's happened is because they receive government money and they are considered a healthcare institution, they're being told that like every other healthcare institution, they're going to have to do euthanasia. Now, they themselves may not have to do it, but they're going to have to allow the killing doctors to come into the hospice and do the act, okay? So let's be quite clear about the Delta Hospice Society. As much as the Delta Hospice Society opposes euthanasia, they've had several people ask them for euthanasia, and they then arranged the transfer. So I'm not suggesting that's a wonderful thing to do. What I'm saying is the government can say what they want. The Delta Hospice Society was not in any way denying people their quote, quote, euthanasia. They were just saying, we as an organization want nothing to do with it. We're not going to do it. We're not going to do it. We're not going to participate in it. We're not going to let a doctor in here to do it, but we will transfer you somewhere else and they can take care of you then and it could be done, okay? So it's not like they were standing in the way. So all these attacks against the Delta Hospice Society that they were imposing their beliefs or whatever, well, whether we like it or not, they actually weren't imposing their beliefs. They just didn't believe in doing that. One of the terrible consequences of this totally unjustifiable government enforced panic reaction to COVID. Well, I agree with that, Roger. In fact, we've gone too far, but that doesn't mean we shouldn't wear a mask when we're around other people. Is this slide deck document that we should draw key messages from our conversation with MPs? I do have the key messages here in the slide deck, Philip, and so I can send it to you, and I can also send you articles. I've been publishing articles, but you'll notice that I do have here key messages, links to the MPs, and also if you go to the petition online, you'll see that there's key messages there also. And I'm happy to send that to you, okay? Not a question, you just email me, never a problem with that. And are there any other questions? Yeah, where are the clergy from the different faiths is the question I got from Chardine. Thank you, Chardine. Some are excellent, some are very good, and some are really concerned, whether it be bishops, rabbis, do they weigh in? Well, in fact, the Canadian Conference of Catholic Bishops has been weighing in. There's a group of rabbis, there's others who have been weighing in. So as I say, some are excellent. Would it be nice if all of them were? Yes. Can I control what they do? No. So let's just leave it at that. But anyway, good question, Charlene. Are there any other questions? Because we are approaching 8 o'clock. So I'm happy to share this with you. Now, if you want more information, you can go to my blog. And I'll just put it down here. The blog is, actually, it shouldn't be this, but it is, Alex Schadenberg at blogspot.com. Now, if you go to the blog, you'll notice on the right-hand side of the blog, there's what you call all the items are different topics. One of those topics is Bill C7. And you'll see that there's quite a few articles about Bill C7. And in there, you also have the talking points. And I always link. So therefore, if you want to read my commentary on, for instance, the Quebec court decision, you would simply just link to it, and it brings you straight to my commentary on the Quebec court decision explaining everything. Where is it defined that euthanasia or assisted suicide is actually healthcare? It's not defined that way, Jackie. I'm glad you brought that up. Very good question. Jackie asked, where is it defined that euthanasia or assisted suicide is actually healthcare? In fact, it's not. It's not defined that way. The federal government legalized euthanasia not by calling it healthcare. Quebec did that, as those who followed the Quebec debate know that Quebec has a different law than the rest of Canada. The federal government legalized euthanasia by creating an exception in the criminal code. So if you read Bill C-14 and what it did, you realize that it was actually honest. It creates an exception in 2 spots in the criminal code. The first spot is under homicide. So the government clearly admits that euthanasia is homicide. So when these people start attacking Alex Schadenberg saying, oh, he calls euthanasia homicide, I get these interviews and they'll call me up and saying, oh yeah, you've called euthanasia homicide, ha ha ha. I said, well, look at the legislation. The legislation calls euthanasia homicide. It just says there's an exception to homicide. And then the other section, of course, is under the Assisted Suicide Act. It created an exception to the Assisted Suicide Act. And so you have a situation where we have 2 different laws in Canada. You've got the Quebec law, which legalized euthanasia through healthcare, and you've got the federal law, which did it to the criminal code by creating an exception, okay? I actually want Bill C-7 stopped. The reason I say stop or amend, obviously speaking, if you can't stop it, but you can get it amended, that's what you want. My fears with this minority government, there's going to be some horse trading happening, and I'm not sure how Bill C-7 is going to end up. Gordon makes a statement here, a good statement. In the Quebec law, it is, and other provinces accept that interpretation. That's correct. The Quebec law defines euthanasia and assisted, well, it doesn't have assisted suicide. The Quebec law is euthanasia. It defines it as healthcare, and other provinces have accepted that interpretation, even though it's not. The other problem is the Quebec law also defines end-of-life care as equal. So it defines euthanasia as part of end-of-life care, and then it has euthanasia and palliative care as part of the same envelope, which of course is ridiculous. And you could read my commentaries on the Quebec law that I made. The fact of it is that the Quebec law then springboards into the rest of Canada. Yes, that's correct. But the federal law doesn't say that. The federal law does not define it as healthcare. No, it does not do that. Now, are there any other questions? Anything else at all? So I want to thank everyone who participated. I also want to thank Oxford County Right to Life. It was them who contacted me first saying they wanted a webinar on this issue. And when we discussed it, I chose this date with them, October 8th, for a couple of reasons. One is I assumed that the new Bill C-7 would be out by now. And I was right. The new Bill C-7 came out on October 5th. So, because I didn't know if they were going to change it or not. I had no idea. They didn't change it. Secondly, my anniversary was October 6th, so I couldn't do it on the Tuesday. And I took a couple of days off with my wife, so I was gone October 6th and October 7th. So that brings me to October 8th, which is today. And there you go. Now, for those people who sponsored my half marathon run that I did for Compassionate Community Care, I did complete the run, if you're wondering, and I did it in a faster time than I expected I would do it in. I had hoped to do it in an hour and 53 minutes. My actual time was 1 hour and 50 minutes and 23 seconds. So that was pretty good. So I'm happy with that. And I believe that it's about 8 o'clock, and I don't have any other questions. Anybody can email me, info@epcc.ca. You see it here. I'm happy to send you my information without any question. Luana Morello is asking, Alberta government is giving $20 million into palliative care and includes free euthanasia for palliative patients. Well, I hate to say that. That's very sad. Congratulations on my run. Thank you, April. That's very kind of you. It's very sad that they're giving free euthanasia for palliative patients. When did euthanasia become, how would you say, equivalent to palliative care? 20 million into palliative care, if it was done properly and providing the care people needed, then it wouldn't have anything to do with euthanasia, would it? Jenny said, thank you for what you do, Alex. Thank you, Jenny, too. I'm thinking that it's about 8 o'clock and no one's going to join my next seminar, my next Zoom meeting that I have if I keep going on. So thank you very much, and talk to you again soon. Good night.